Good afternoon, distinguished guests and colleagues. May I too acknowledge the Ngunnawal and Ngambri people, the custodians of the land on which we are meeting, and pay my respects to their elders past and present. Like Commissioner Gooda and Senator Nash, I'm very pleased to be standing here today to be part of a very significant event for over 120,000 allied health professionals throughout Australia. Their national professional associations are standing together as allies in health, as we stand with the newest of the national allied health associations, Indigenous Allied Health Australia, to commit to contribute to strategies to improve Aboriginal and Torres Strait Islander people's health and well-being. We are here today to acknowledge that there needs to be significant improvement in the health and well-being of Australia's First Peoples. The Close the Gap campaign highlights the absolutely unacceptable inequality in the health of Aboriginal and Torres Strait Islander people compared to other Australians. Health impacts on people's capacity to participate in their everyday roles as family members, as parents, as children, taking part in learning and working and being involved in their communities. Allied health professionals work in primary health care in a range of community health settings, both mainstream and Aboriginal community controlled, in acute health care, in public and private hospitals, in mental health services, aged care services, in palliative care, in schools, in people with disabilities, in the justice sector, in health promotion and fitness, the diversity of allied health meeting the diversity of needs. Allied health professionals are thus in a unique position to impact on the complex socio-economic determinants that influence Aboriginal and Torres Strait Islander people's health and well-being. Some of our guests may not have realised just how many different allied health professions there are. The members of each profession bring particular skills and evidence-based knowledge to the work with their clients. Interdisciplinary teams are one of the cornerstones of quality health care. In these teams you find a variety of health practitioners with their particular knowledge and skills from nursing, medical and allied health professions, working with support staff to most effectively meet their clients' needs. It is estimated that collectively, the Australian allied health workforce provides over 180 million services annually. Australia's allied health professional associations are today signing this statement of intent to commit to strategies which will contribute to closing the gap. Equality of access to affordable and appropriate allied health services is something we all advocate for. Additionally, allied health services need to be offered and provided in culturally sensitive and respectful ways. This is something that every allied health professional can individually commit to. To support them, we, their professional associations, advocate for improved teaching of Indigenous health to allied health students and can encourage members to participate in professional development studies in working with Aboriginal and Torres Strait Islander people. The professional associations also commit to supporting Aboriginal and Torres Strait Islander peoples to undertake training to become allied professions themselves. The quality of care for our Indigenous people and the culture of health services will benefit greatly from a more equitous representation of Aboriginal and Torres Strait Islander people in the health professions. We must all work together, achieving an increase in the number of Indigenous allied health professionals. Our many members in remote Australia have additional challenges, like other remote health professionals, in being able to effectively work with their communities and clients. We advocate for the same support for allied health professionals as are provided to doctors working in these communities. The health of the great many urban Aboriginal and Torres Strait Islander people also needs to be better addressed through the delivery of accessible, affordable and culturally appropriate primary care services that make use of the broad range of skills of allied health professionals. So today really is a call to action. Allied Health Professionals Australia and our 18 member organisations and 4 affiliates are thrilled really to be here with our colleagues in Indigenous Allied Health Australia to sign this statement of intent as we begin a journey together to contribute as we can to strategies which will lead to improvement in the health and wellbeing of Australia's First Peoples. Thank you.